Hi, I'm Anthony Ehresmann, and welcome to Urbana Leader. Today we have a great program. We're going to talk about the basically the mental health condition of our county and Logan County, for that matter. We have two very good guests on. Down here we have Pete Floyd, and he is with NAMI.
Right.
Okay, I'm getting it right. And then we have Tammy Nickel, who is the what is MHDAS?
Stands for the Mental Health, Drug, and Alcohol Services Board.
There we go. Okay. That saved me a mouthful. I'm telling you what. Okay. Let's start with Pete for a minute. First, could you tell us what the letters NAMI stand for?
Stands for the National Alliance on Mental Illness.
Okay. And how long has it been in existence? When did it start? And how long?
Well, NAMI was founded in 1979 as a result of families meeting together in homes. These families had people that had serious mental illness, and so they would meet and try to figure out strategies to help their loved ones to get the mental health services that they needed to have a better outcome in life.
Okay. And well, of course, now we know what MHDAS means. And can you tell us what the role of that particular board is in the two counties?
The Mental Health, Drug, and Alcohol Services Board for Logan and Champaign counties supports healthy communities by funding services for mental health and addiction in both counties.
And that would be both drug and alcohol addictions?
And mental health.
And mental health. Okay. I did not know that. Pete, can you tell us how long you personally have been involved with NAMI?
I've been involved with NAMI for 5 years. I serve as the president.
And how long have you been president?
5 years.
5 years. Okay.
Right.
And what did you do before that?
I work for myself personally. I have a home repair business. That's what I do.
Okay.
But yeah, we basically, NAMI is basically volunteer.
Okay, and so, and here's a good question. What was the driver that got you to do this? Why, I mean, if you're a busy person, and you know, why would you want to get involved with this kind of thing?
The story is a little long, but it's basically this. I am an ordained Baptist minister. I was in ministry for many years. And then in 1986, I had an onset of my own mental health disorder, which is major depressive illness. Could no longer function in that capacity as a pastor. An opportunity came to serve in NAMI, which I kind of view as a ministry for me, helping people like myself who have mental health disorders. So that's really how it came about.
And so you saw a need in the two counties,
right,
and stepped up to the plate, and
right, and here I am.
Excellent. I'll tell you what, and today things seem to be good reasons to seek help.
Yeah, NAMI, we consider ourselves the voice on mental illness.
Right. And I'm very heartened, but because I hear more and more elected officials talking about mental illness more and more often now.
It has to be addressed.
It's making me feel a little bit better about, because it used to be something that, we talked about that in hushed terms, right, at the dinner table, and it was never brought up, and that kind of thing.
Statistically speaking, and the community needs to understand that 1 in 6 adults suffer with a significant mental health disorder.
Really?
1 in 6.
1 in 6.
1 in 4 families is affected by a serious mental health disorder.
And do we find that demographically, is there an age group that's more susceptible to mental illness, specifically things like depression? Or
generally, onset of serious mental health disorders, unfortunately, strike young people, college years, late teens, early 20s.
Just when the pressure starts to come on, that's when they're having the most trouble.
And we view these as brain disorders, as medical disorders. And
it is treatable.
Yes, since they are medical conditions, there are treatments available. We support a biological model of treating mental health disorders. So yes, there is treatment and hope of recovery, and we support a model of recovery in mental illness.
And how to, and obviously you need funds. I mean, I serve on a lot of volunteer and nonprofit organizations myself, and funding has to come from someplace in order for you to do what it is you do. Do you receive funding from the
Mental health, drug and alcohol services.
Yes, yes, we do.
I'm so glad you're saying
They've been very kind to us. They do help us.
All right. And so how is it that what measures do you take to decide what programs to fund and what ones not to fund?
Well, we want to make sure that there's an array of services in the community that meet the needs of all ages of residents, all the varied needs, everything from prevention, education on the early end to intervention with regular outpatient treatment services, and then even the high-end inpatient residential type services. So we're looking at making sure that we have those things available, what we don't have available right here in our community, that we are able to contract for those services.
Now, it says, I have my questions written down. It seems we hear a lot more about mental health and addiction issues in the media these days. We were just alluding to it. We've seen more and more elected officials come out and say so. And I've seen there are, a small number of our elected officials who are trying to make sure that these programs are properly funded or adequately funded. Are we lacking in resources, or do we have everything we need here in Champaign and Logan County in order to meet the needs of our constituents, so to speak? Are we pressed for money?
Tammy, I know you can probably speak to that better than I can.
Funding is an issue. There have been, in the last couple of years in particular, there have been some significant cuts in our state funding. And the board functions on monies that come from the state and the federal government, as well as our local levy. And our local levy is up for renewal here coming up in November, which is one of the reasons we wanted to have an opportunity to share with folks the importance of what we see happening and why it's important to keep those things in place.
So do you receive community service block grant monies?
No.
Okay. Do you? Does your organization? Okay. That's so unfortunate. Because I would think that the more that we address this kind of problem, and we see it every day on the news, and we see it every day when we walk down the street, the need for these kind of services. And the cost that it is to deal with it by ignoring it is much greater than it is meeting it head on. I think that we are actually saving money and making a better investment in the future of both the counties overall if we are not saying, well, I don't care about that kind of thing. I don't want to see that kind of thing on the street. I'll ignore that kind of thing. And so we tend to not fund those kind of things.
Right. I think we
The fact is, Anthony, is that when we see early onset and in mental health disorders, earlier treatment means better outcome. So that's a solid fact.
That's a solid fact. And earlier treatment and better outcomes cost a lot less money.
And unfortunately, people that don't get mental health services or get treatment in the early stages of their onset, many times because of certain behaviors, they end up in the criminal justice system, and that becomes a much greater burden.
Oh, absolutely.
On taxes.
I was watching a program, and strangely enough, and it might seem counterintuitive to people here in Ohio, but Kentucky actually has a very good mental health program in its criminal system, as far as
to see they get to proper services,
right? See that they get the proper drugs. The part that where it falls off is after they're released, they're not given enough medication and enough support after they've left to get them to the next level, which might be residential housing or a safe house or something like that, where they can continue their medication. So they tend to fall off of their medication because it's so hard for them to go on to that next step. Do we have that problem here in Ohio?
We have, Ohio has a program called Community Linkages, which is supposed to allow the prison system to notify the local community mental health system when someone on medication with a significant mental health diagnosis, when they're about to be released. 30 days prior at least, kind of gives them a heads up so they can get them on the schedule in the office. So
and make sure that, because I tell you what, I have found, and I've met a few, like I have a certain, I'm an Episcopalian and I'm involved with my church, and I know that there's a ministry for that. And people that I have run into, that's one of their biggest fears is, now I'm going to get out, and I'm only going to have, basically I'm going to have 10 days worth of medications. After that, who knows what happens.
We need support services to carry those people.
And then those people end up, and they fall off of their medication. They end up committing crimes.
Right. It's an
revolving door. Costing the
thing.
taxpayer more money,
right,
because they end up back in the service in the justice system again, or in the prison system again, and so they end up costing the taxpayer more money for a longer period of time. So I want to thank you both for what you guys do for the counties, both Logan and Champaign County, and we hope to have you on the program again.
Thanks so much.
Thanks a lot. Appreciate it.
Thank you.
thank you.
Thank you. We're going to be right back. Thanks for watching.
The Urbana Leader is sponsored in part by the Depot Coffee House, a gathering place for locals, a resting place for bicyclists, and a haven for history and railroad buffs. Located 6 blocks west of Monument Square on Miami Street in Urbana, the coffee house can be found in a refurbished 1890s train station on the Simon Kenton Bike Trail. Free Wi-Fi, fresh baked goods, local artwork, and good conversation can be found every day of the week at the Depot.
I'm Anthony Ehresmann. Welcome back to Urbana Leader. We have now with us Dr. David Hggins, who is with
MHDAS Board, Mental Health Drug and Alcohol Services.
Right. The long one. Sorry. And then we have Molly Smith, who's with Consolidated Care, which is an easy one for me. Thank you very much. I'm so glad you're sitting next to me. And we're going to talk about that first, because I think this is an area that is a major concern. It's been in the newspaper a lot. We do have a lot of teenagers, young people who are, basically they're committing suicide for some of this, for what they feel are very, very serious things that are happening in their life, and rightfully so. And it seems to be more prevalent today. I mean, every time I pick up the newspaper, I'm finding out some kids committed suicide because they were bullied, or for drug or alcohol abuse, or whatever the situation is. So I wanted to, first I would like you to tell us a little bit about Teen Screen. What is it, and when did it start, and what is it?
Teen Screen is a free confidential mental health screening that we offer to actually every single school in Logan and Champaign County, so that's all 9 schools.
Okay, good.
And this was an initiative from the Suicide Prevention Coalition, an effort to get out and educate our youth, and to also help identify youth that might be struggling and need some form of treatment. And
do we, demographically, are we here in, because we have it's a very diverse 2 counties. It really is. I mean, Southtown a little bit bigger in Urbana, but mainly rural with a small town, small and very intimate atmosphere as far as community goes. Do we meet or exceed, or are we lower than the national average? How do we fit into that?
Champaign County has actually ranked a little higher in the 88 counties for Ohio. So Champaign County usually stays within the top 15 counties as far as losing people in their community to suicide, and that's higher risk than Logan County. And they say the more rural the area, the higher the risk.
What? No, you would think that just doesn't somehow that just doesn't click. Why is that?
Well, we say in suicide prevention that we can save lives by having more eyes on people. That suicide prevention really boils down to watching out for those warning signs and then having opportunities for intervention. So like in New York City, you can't take more than 5 steps without maybe 100 eyes on you.
Right.
And if you take another 5 steps, you can find a treatment facility.
Here you can go all day and nobody's
Absolutely.
seen you. And now I had some letters here. What is CIT?
CIT is another important program. This stands for Crisis Intervention Team.
Okay.
And this is a law enforcement training. And this is a 4-day intense training for local law enforcement as well as corrections, where we train them in being better educated and knowing how to respond to mental health or addiction crisis. So we teach them some skills and we educate them about the different types of mental illness they may encounter on their job, and then how to respond to them in a way that both increases a safe resolution as well as decrease officer injury and decrease the chances of having an injury to the subject at risk.
And also to decrease the number of people being arrested.
Right. I would think that, in some cases, a certain amount of law enforcement empathy on the part of law enforcement for somebody who might be dealing with a personal problem might go a long way to keep them out of jail.
Right. When we first started it, not all the police officers and sheriffs were really excited about being there, but once they went through the training and got back out in the streets and started using it, we got nothing but really positive feedback, and the other groups coming through have been more excited about learning it because they've seen that it works.
They see that it works. And I don't know a lot of police officers. I mean, I'm sure there are police officers out there who just love to arrest people, but for the most part, it's been my personal experience that that's the last thing they really want to do. And if they know how to identify potential problems, that certainly can be the resolution of whatever encounter that you might have with
and there's a certain number of people in the city that they get called to on a regular basis. And so once they've learned through CIT how to handle these situations, they're able to diffuse them while they're on site.
Right, because going back to what we were talking about with some previous guests, if we know that somebody has gotten out of jail and they are under some kind of mental health plan, then we know if we're responding to that household, we know what we're getting into. And the sooner that we can make sure that these people are following their plan when they exit the criminal justice system, and that they're on their meds and not going back to jail. And if we teach our police officers, this is, under any other circumstance, this is a person who is very law-abiding. And it could be the fact that maybe they did not receive their medication, or there was a lapse in the time frame for them to receive their, they ran out and they couldn't get more because of whatever services that are not offered in time for that kind of thing. So.
And I think one of the other things that goes along with, once they got the CIT training and saw the value of it, Molly helped lead starting a loss team, and we're the first one in the state of Ohio. And Molly can tell you a little bit more about it, but it's been a real valuable.
All right.
Yes, well,
tell us about it.
I think some of the very important things that have come out of these trainings, and again, we're spending 4 days with officers, is it's really increased the collaboration and the relationships between mental health and law enforcement. So that's priceless. In addition to that, through the Suicide Prevention Coalition, one of our additional initiatives is to respond to families who lose a loved one to suicide. So we're certainly focused on prevention, but we are also focused on an idea called postvention. And so this is responding to a crisis afterwards. And the loss team provides different types of responses to families at the time of their loss. So on occasion, we can respond at the scene, initiated by law enforcement or the coroner, and really connect with those families immediately and give them really valuable information and resources and help them feel not so alone and connect them with other people in their own community who have gone through such a similar loss.
So you're on a different kind of ministry. And how is the mental health district funded, Logan-Champaign County, from your perspective?
From our perspective, it's funded through the state, federal grants, federal dollars, and our local levy. And so our counties have done a really good job of applying to grants to keep programs going. But as if the economy changes, the grants are dying out, our state dollars are dying out. So we're using more and more levy dollars for funding. It's about levy dollar is about 24% of our funding.
Really?
Yes.
And you don't receive any community service block grants either?
We're part of some state federal block grants, but
Okay.
no direct community service block grants.
All right, and how is what you do funded?
All of
You
these
get money from him?
activities are funded by the Mental Health Board, yes.
All right, good, good. And I think what you're doing is very, very, very important. We've lost a lot of very young people there.
Absolutely. Suicide is the third leading cause of death for young individuals aged 15 to 24.
And I'm always shocked at the reasons they seem, and for me, as a 52-year-old, they seem so trivial. But maybe I've forgotten how enormous those kind of things can be when you're that young. They seem insurmountable.
Right, and that's one of the good things about the teen screen, because they're getting, every parent who gets permission, their kid gets to be seen, and they can identify if there are any depression issues.
And just from the previous conversation, from our previous segment and this segment here, it seems to me that the more that we prevent these things, the more that we are able to step in and help before something happens, the more in the end, I mean, because like you said, 25% of your funding is a levy, right? Now you have a levy that's coming up.
Right.
And correct me if you're wrong, it's no new monies, it's just a continuation of the same levy that's always been there all this time.
Yeah, and it's 5 cents a day.
It's 5 cents a day.
If you're a $100,000 homeowner,
right.
Less if your house is less than that.
And that 5 cents a day, if you think about it, is a major deal, because dealing with the loss of your neighbors and your friends is something that you cannot put a price on. And 5 cents a day is a lot cheaper than $65 a day per bed at Tri-County.
Yeah, and one of the other things that goes with that is if people get treatment, they recover. And if they recover, they get a job. And if they get a job, they pay taxes.
They pay taxes. So there is there's a direct line back to the return on investment for
right.
Your 5 cents. It is, tripled, doubled, and quadrupled over and over and over again. And and before the program ends, I want to make sure that I thank you for the kind of work that you do is often goes unnoticed and unthanked. But I'm not going to do that. So we're going to definitely thank you. Let me ask you about a couple of things. There was I have some notes here. What exactly is a recovery zone?
Recovery Zone is a consumer. The Recovery. It's a consumer organization. It's here in Urbana. A few years ago, they met in West Liberty, and there was like 8 or 10 people attending, and it was on the second floor. There's a lot of people that can't get to the second floor, right. And there's a lot of people that couldn't get to West Liberty. So they divided it into two, one for Bell Fountain, one for Urbana, and so they've gone from 8 to 10 members. They have 59 members. They average 12 to 15 people every day there. Mm-hmm. They have programs to help people find jobs. They have a little business. They do some cleaning to help people to make some money for Recovery Zone and also to help them. They work on programs during the day to improve their skills, and it gives people a safe place to go. So right. they bought their own building here, the Mental Health Board helped. Bought their own building. They have their own building out here in Urbana. And
they are paying their own bills and earning their own money.
Yeah, they earn the money to pay the bills.
I've seen programs like that out in California, especially Silver Lake, where the entire facility is funded through the various different both mental, drug, and alcohol recovery organizations. Everything from NA to AA and the whole thing. Mm-hmm. All of their proceeds funds the whole facility, and it is, like you say, where you might see meetings where only a few people, now you see buildings with literally hundreds of people receiving help, and that's a really good thing.
And one of the things we've found in the past couple of years is that more and more of the people in the hospital are people that were not in the system. So the very first time that we're ever seen is when they're in an emergency room and end up in the hospital. And so the Recovery Zone gives them a place to go when they get out of the hospital if they're not ready to go back to work. It's someplace they can go and have people to talk to during the day,
right.
And rebuild their skills.
Right, and rebuild their skills, and then be able to market those skills. Now, very quickly, because we don't have a whole lot of time left, can you give me some quick statistics about the services provided through the Mental Health Board?
Sure. They saw over 2,000 people last year, and out of those 2,000 people, 6,600 services, mental health services, and another 2,000 drug and alcohol services were provided. And these are all the new people. There's about 2,900 people that are in treatment. And if you think about it, on the average, 50% of people sometime in their life will need mental health services. You know, it may just be for a short time, it may be because of a death in the family, or it may be because of a major problem like we talked earlier, the severe, persistently mentally ill. We want to have services for those people. And so when these people come in, we make sure that we have core benefits available to every person so that they can get treatment if they need it. Some people are no insurance, some people are underinsured. We want to make sure that that the people in our community get what they need.
Right. And I want to point out again to our viewers, the prevention, treatment, and ongoing, what's the word I'm looking for, the ongoing treatment of those people is a fraction of what it would cost to deal with either the loss of a loved one or neighbor, or having those people end up in jail.
Yeah.
And I'm going to mention this. There was a frontline story about a guy who went in for shoplifting, mental health problem. He ended up doing something in the jail that added to his time, and what should have been a 90-day sentence or less, or even a slap on the wrist and released, turned out to be 15 and a half years. And his he committed no crime on the outside. It was because he was a difficult person suffering from mental illness, and it manifested itself in, you know, being hard to deal with within the jail system. So they kept adding an assault charge here and this kind of thing. And when the guy finally was finally released after 15 and a half years, well, he was given 2 weeks worth of medication, and then he was back in there 3 months later, because that's all he was given. There was no support afterwards.
Yeah, we work really hard on that now. First, we try to keep them from going to jail, because it isn't the right place for them. You know,
it's not the right place. I mean, these people need to be in either hospitals or under supervised situations.
And then we also try to make sure they have enough medicines so they can see either their family doctor or psychiatrist once they come out of the hospital or come out of jail, so that they don't get off their medicine. All
right. Well, I'm going to encourage everybody to support the levy this year, and good luck.
Thank you.
Thank you.
I'm going to. And if you don't know, we actually do all of our videotaping down here at the Depot Coffee House in Urbana. And I want to point out that they have an open mic every Friday, every other Friday, and they have bands every other Saturday. So if you like music, come on down to the Depot and enjoy the music. If you want to be a sponsor, please email us at urbanaleader@hotmail.com. And don't forget, you can always find us on the web, on YouTube, Facebook, Twitter, and also we have a blog where you can watch all of our videos. It's at www.urbanaleader.blogspot.com. And like I said, if you don't get 1, 5, or 13, tell your friends. You can always see us online. And thanks for watching the program. Thanks.